Thank you very much. Good morning, everyone. Can you hear me okay? Can you put a one in the chat if you can hear me okay? As mentioned, my name is Jackie Walker, and I am proud to be the Nursing Division President at SCIU Healthcare. You know, like most people working in healthcare, I got in this profession because I wanted to help people, just like my mom did, who's also a nurse, and I watched her through most of her career doing that. But like all other healthcare workers, I got into this profession expecting at the very bare minimum to make ends meet. But in 2023, well, Jim, you just kind of like laid it all out for us. The levels of inflation, the racist, anti-worker, anti-women legislation like Doug Ford's Bill 124, that's not the reality. It's not the reality for healthcare workers. So if you're a healthcare worker, heck, if you're any worker and you're struggling to make ends meet, can you let me know by putting a one in the chat? I talked to a nurse the other day who told me that she was ashamed to tell her friends and family just how poorly she was doing as a nurse, making $27, $26 an hour to work in long-term care. And the shame just kind of shook me. And nobody chooses a career with the expectations that they're going to need 2 or 3 jobs. I know registered practical nurses didn't think that that was going to be the reality, that they're going to have to work 2 or 3 jobs just to put food on the table, like that $9 turnip we saw in the chat, or keep a roof over their heads. But that's the reality when you're a healthcare worker working in Doug Ford's Ontario. That's the reality. And the workers, the nurses, the dietary aides, the PSWs, the paramedics, they're saying enough is enough. And that's why so many of us are leaving, from dietary aides, personal support workers, and everybody in between. They're leaving the healthcare system. I know an RPN who left care work to go work in the the lumber industry. I was like, how did you go from one to the other? She was sick and tired of being sick and tired. She was sick and tired of not having money to pay her bills and her rent. And so she said, I got to do what I got to do. And she left. Now, when she left with a broken heart because she knew that she was leaving behind people that needed her. And I'm not just talking about her patients, which meant a lot to her, but I'm talking about her coworkers, because for every one nurse or PSW or dietary aide or laundry aide that leaves, it leaves more work and more of a struggle for those who are left behind. So let me see if you can put a one in the chat if in the past 3 years you've needed to use the healthcare system. You needed to go to a hospital, if you have a family doctor, you needed to go see that doctor. Okay, the chat is blowing up. All right. Now, if you know somebody who works in long-term care or retirement, or who lives in long-term care, maybe a loved one, maybe a loved one's loved one. I'm still seeing lots of ones in the chat. Okay, how about if you know somebody who receives home care, community care? Yes. So no matter how we've interacted and how you've interacted with the healthcare system, it just takes minutes for many to see the impact that nurses, PSWs, social workers, any healthcare worker who's leaving healthcare, to see that the impact that it has on quality. They didn't do that by choice. They didn't drive the system into the ground. This was a systematic plan by Premier Doug Ford. And I'm thinking about the past couple of days, and I live in Toronto, so there's not actually avalanches, but this problem is like an avalanche. And with every opportunity that Mr. Ford has to fix it, opportunities, ideas that are handed to him by unions, by community groups, by activists and advocates, we just watch the snow get deeper and deeper, because really the results that he's offering are not helping us. And to get to that, we say enough is enough. Healthcare workers are living with moral injuries and suffering from levels of burnout that we've never seen. They're burnt out from just being in the place. They're burnt out from going to job. They're burnt out from saying, should I pay my electricity or should I buy my kids some lettuce today? They're burnt out and their tanks are empty, literally empty. I know nurses who said, I've just taken the bus to work now because I can't afford to pay my rent and put gas in my car and pay my insurance. They're worried about all of this. And we're losing great healthcare workers to burnout because of the lack of joy in work, because of the lack of connection in work, because of the moral injury. And more than important and maybe more scary than like losing workers, which is scary. But people are losing their spirit to care and to give care. And we've got to say enough to that, because things are bad, and I get it, but it's not too late. It's not too late to save our healthcare system. It's not too late to keep healthcare workers afloat. All they want is working environments that are safe. So if this means having security in a mental health unit where nurses are getting beat up every single day, that's all they want. They want enough wages to feed their families and pay their bills. Not 1 or 2 or 3 jobs, which is infuriating, right? They just want to have one job. They just want to have retirement security. They just want to have sick days. You may be shocked to know that most registered practical nurses in Ontario do not have access to this. Retirement security, pensions, vacation, benefits, they don't have it. Put a 1 in the chat if you thought that every nurse in our province had access to all of these things. Retirement security, benefits, a living wage. I know you would think that, but like that nurse who told me that she's just ashamed to talk about how little she makes and how much she struggles, even to her family, she knows she's got to use her story to share it and be a little bit vulnerable, because it is not a problem we created, but it's a problem that we suffer from and we struggle through. And it's a problem that nurses and healthcare workers are going to show up to fight for. So if you are a union member, if you're a community member, this is a fight that we're all connected in. And it doesn't matter if you are a laundry aide, like how I started in healthcare, who's being asked to take on PSW roles or nursing roles. People are fed up. Healthcare workers are fed up, and they're sick and tired of being, screwed around by the government. I wanted to ask, how many of you have heard about emergency rooms being closed all over our province? If you've heard of that in the past 3 years, I want you to put a 1 in the chat. If you've been impacted by this, I want you to put a 2 in the chat. So just last week, anybody from Niagara, I know I saw some people from Niagara Health, the hospital, announced that they're going to be closing and restructuring some of their areas in the hospital. So folks in the community who need emergency surgeries are going to have to drive 40 minutes. So if you need emergency surgery after 4:30 p.m. Or on a weekend, you're going to be, required to drive 40 minutes to the next city, to Niagara Falls, to get care. Emergency surgery 40 minutes away. How many lives will that cost? How many workers are going to be displaced? And the amount of workers right now who are very nervous about they're shutting down here, the workload's going to increase over here. It's just a disaster, and it's a crisis. But that's Doug Ford's Ontario. And we know he has the power to fix it. And Jim gave us a good list of things that need to be concretely changed. But Doug Ford has our solutions. They're written up. They're beautiful. They make sense. But it's not enough. And so that's why it's so important that we're here today. And we heard Patty talk about organizing and strategizing and escalating our tactics and our actions so that we can actually scare the crap out of Doug Ford, because we know what he wants from us and the rest of Ontario. He wants our votes, right? And maybe enough of us didn't vote last election, but that's the power that we have to get to work today, to make sure that we are sharing our stories in a way that will help build empathy and build power so that we can actually fight and we win. Because I know when Doug Ford is on TV and he's saying, my friend, he's not talking to us. He's definitely not talking to me. And I see some of you here. He's not talking to you. He's talking to his for-profit private companies, right? Like the Siennas, like the Riveras, like the Chartwells. These are long-term care facilities chains that have done the best coming out of the pandemic, like profit-wise for their shareholders, but have had the worst performance when it comes to deaths, the worst performance when it comes to workers leaving work sick, right? Time after time, it becomes clear. It's clear that when private companies become involved in healthcare, that they start to cut corners, that they start to put, I see it in the chat, put profits over people. And that's Doug Ford's Ontario. And we need to, I hope we all continue to come together so that we can stop this. We can remember the amount of seniors that were harmed, that were hurt, that even died because of bad policy and because of a broken system that really just got, a light shone on it in the past 3 years. I know that I'm not going to be trusting the system when my sister's baby needs emergency surgery, or if my mom, God forbid, needed some type of surgery. I'm not trusting the system right now. What if you're a cancer patient and you need aggressive cancer treatment? Is waiting 3 months going to keep you alive? I know it didn't keep my best friend's dad alive. Enough is enough. The hurt goes deep, whether you are a healthcare worker or whether you're someone who's needed healthcare in the past 3 years. And that's where all of us come in. All of those things that Jim listed that need to be changed to actually come out on top, or at least, have a little survival in us, those are going to take our action. Those are going to take us organizing and strategizing and looking where we can bring other people into the movement, because we have to fight, because nothing is ever handed to us on a silver platter. That's the other people. We have to fight. But I'm confident because when we fight, we win. And Dina laid out a lot of wins. It's important for us to share those wins, because when we fight, we win. Have you heard that? Can you say that with me? When we fight, we win. My family can't afford for it to get worse. My mom is still working as a nurse. I have way too many nieces and nephews. You probably can't afford for it to get worse. And that's why it's so important that we're here today, so that we can learn to fight together. We can make a plan to fight together, and we can take all of this anger, enough is enough, doesn't come from a place of things are fine. It comes from a place of anger and emotion, which is so important in our movement, because emotion brings motion. Emotion brings motion. So we have to lean into that, and we have to feel that, because our fight needs that from me and from you. So put a 1 in the chat if you're here to fight. Okay, the ones are blowing up. Put a 1 in the chat. Put a 2 in the chat if you think that when we fight, we will win. Awesome. Well, thank you all for taking the time to hear me out, inviting me to join this fight with you. I'm going to hand it back over, and I will see you on the front lines fighting.
Thank you, Jackie. When we fight, we win.